First, I'm going to perform a visual exam of the head and neck region and note any potential abnormalities. Next, I'm going to ask the patient to lower her head forward and begin palpating the occipital nodes. Now I'm going to palpate the submental and submandibular lymph nodes. Next, I'm going to palpate the head and neck to detect any palpable lymph nodes comparing the left and right sides. I'm going to ask the patient to raise her tongue to the roof of her mouth and check the sublingual and submandibular glands. Now I'm going to ask the patient to clench while I palpate the parotid glands. Next, I'm going to find the TMJ and ask the patient to open and close, then check for any abnormalities. Then I'm going to examine the pre- and post-auricular nodes and compare each side. Now I'm going to ask the patient to turn her head and lower her chin. I'm going to examine the anterior and posterior cervical chain of lymph nodes on each side. I'm also going to palpate the supraclavicular nodes. Next, I'm going to examine the thyroid for any nodules or masses. Finally, I'm going to ask the patient to swallow. This will cause the larynx to move up and down so I can check for mobility.